that is something that we have to be careful of as clinicians is the word no, because it can be super triggering for children.
Yeah.
As a clinician, I don't think I really say no. I would always expand on it.
Yeah.
Because first of all, if they've got a parent all day saying no, you're going to get them offside even more in your sessions with their behaviour. Saying no doesn't really serve a purpose.
No, that's
unless
right.
they're doing something that threatens the safety of the child.
Yeah.
But generally they actually have a language delay associated with that. So they're not understanding no anyway. This is something that comes with experience and being in the moment. I think you say no and then you realize, wait, I shouldn't have said that.
Yeah.
You then recorrect yourself. And it's with that experience, I wasn't always able to sort of quickly shift or change a situation.
Yeah, it's kind of that almost being able to improvise.
So if a child is throwing a ball at the wall, I don't say no.
Yeah.
I would say, oh, we don't throw the ball at the wall, throw it to me.
Yeah.
And I would always articulate what the behaviour is. I would provide the correction, then provide the remodel.
Yeah.
And I learned that as a new grad early on.
Yeah.
That word no doesn't work. So don't say it.
Yeah.
Don't say it. And half of my children had language delay, so they didn't understand the word anyway. And I would then couple it with the action, remodeling what we need to do.
We are child development obsessed, business besties and mums. And we're here to spill all our secrets.
We have a combined 30 years experience working with children, and each episode we will bring you up-to-date research and evidence-based strategies to set your children up to thrive.
I'm Lizzie Dawson, Australian exercise physiologist.
I'm Emily Mackey, Australian speech pathologist,
And this is the Move, Talk, Thrive podcast. So today we are talking about the wonderful world of behaviour and what do I do if a child misbehaves?
The most common question and also the thing that scares everyone the most.
Yep.
Children are totally unpredictable. You cannot control them.
No.
Which brings so many wonderful surprises and beautiful moments, but also then that fear or of the unknown. What they might do in a session.
Well, let's be honest. If you're not engaging children or a child is misbehaving, it's pretty confronting.
Yeah. And
isn't it?
If you don't have any experience at all with children, yes.
Yeah.
But also even if you have experience, every child is unique. Every child is different. The definition of behavior, every child's behavior is different and unique. You never have a child who will respond to you the same way, who needs the same sort of, talk or communication or strategies.
Yeah,
it's different. And so I think even acknowledge that first off, there is no one answer. I think that's what everyone's looking for. They're like, if a child misbehaves, what do I do? If I can do X, Y, and Z, I'll be fine.
Yeah.
Can't give.
Yeah, so, and I think that means that we all need to adjust our expectations. And that's what I say to parents, practitioners, and educators. We all just need to adjust our expectations and lower our expectations of what we're going to get out of a session with children, because no one session's going to be the same as the other, and we're not going to have a perfectly behaved child. And and us as mums, we know that, and we know that behavior is the outcome of
underlying things.
And we're talking from complex neural conditions through to being tired and hungry. Marley has an outburst and I'm like, honey, are you hungry? Yes. Let's get you
but
some
then
food.
They get to the point where they're too overtired or too worked up that they can't eat because they're so wound up. And then I'm like, all you need to do is eat and you'll settle down. But then they don't eat and then you're like, oh, what do I do?
Or sleep when they're like really tired.
When they get to that point of overtired and you're like, we've tipped the threshold. They're just now off it.
Yeah, totally.
It's interesting because all children respond differently to sleep and eating. Both of my girls are polar opposites with sleep. Evie has always been quite a good sleeper and she does really well. Not really well, but she likes sleeping. Isabel, I don't think she slept through the night until after 1. And that was with a lot of me educating myself on sleep routines and parent training and then trying to be consistent, and involved me and Mackie working with her. And Mackie is more of a night owl, functions really well, not on a lot of sleep.
Same with Pete.
I'm the complete
Yeah,
opposite.
women need more sleep.
This is why we're friends.
Yeah. Yeah.
I need a lot of sleep. So Isabella's a bit more, she doesn't need a lot of sleep, but she still is okay. She's not screaming. She's not off her head.
Yeah.
But both of them, if they get to that point of, you know, being overtired, they can't function, they can't learn, they can't listen, you can't reason with them.
Yeah.
And that's the same thing in our sessions.
Yeah.
If a child is coming in tired, they've been rushed into the session, like even
they've had a big day at
hungry,
school.
You know, you actually need to take a little bit of time to just go, okay, hang on.
Yeah.
What's happening here? It's our job to provide that security, that stability, that safety, that consistency with them.
Yes. I was just writing this week about routines. And it's, you know, the part it can play in behaviour because we're creating a bit of predictability, and we can do that in our therapy sessions. You know, have like, if you've got a boy that is interested in balls, do some throwing and catching straight up, or we play a memory game straight up. And then at the end we do mindfulness, and then they use the paint pens and they draw on the windows. So it kind of shows them, you know, we're nearing the end. So, because, you know, some of the problems that we have around behaviour is actually getting them to leave. Like them going,
that's a real thing.
You know, because it's that transition, isn't it?
And routine and familiarity can look different. So like for some children, they might just need you, like that same person. Other children might need the same room and the same person. Other children might need it, like in a lot of our speech therapy sessions, we use some sort of visual timetable or routine, not with all of our children, but sometimes they need all of those elements, and they need the same toys.
Something that we look at is sensory profiles. So we like to know if, you know, they're hypo or hypersensitive in any of their sensory inputs, so that we can set the room up. We can be mindful about how we're projecting our voice. We can be mindful about how many things are out, and really set them up for success. So there's so many things that we need to be looking at. And again, as we keep saying, looking at the whole child.
That's right. And so I guess, first of all, if you've got a child that's misbehaving, we're just going to use that word misbehaving because most people understand what that means. Basically, you're just not sure what to do with their behaviour. What we have to do is try and define a reason for the behaviour.
Yes.
So I did have one child early on in my career where they would come in and their behaviour was mutism. And so the psychologist was saying, like the mother was concerned, she was taking the child to the psychologist, and the behaviour was the mutism, so they were refusing to speak, but there were times when they were okay.
Right.
When I actually did the assessment of the child and did a very thorough investigation, I found out the child has a significant stutter.
Right.
And so that had impacted them, so they just thought, I'm just going to be silent. And so we do know with stuttering there is a lot of mental health that can go with that, and social impacts that can go with that. This is a prime example. Once we actually started to work on the stutter, the child went back to the psychologist and was no longer having that mutism diagnosis that they were tossing up between, because we'd actually looked beyond the behaviour to what was happening clinically. And it was amazing to see that transformation of that child and for that family. And the mother was like, we could have actually been diagnosed incorrectly. Not to say that that's always, again, every child's unique, every situation is different, but that's an example of looking beyond the behaviour to what is happening.
I quite often say, because we go into the kindies, and so we're working with groups, and if we're sitting down and doing, you know, an exercise on the floor, and little Julie is being really disruptive and fidgeting and moving a lot, I'll always look to see if there is potentially a core endurance issue, because when you can't sit and hold your posture and sit comfortably and you're uncomfortable, of course you're going to get disruptive. Of course you're going to, you know, start moving around, and that might disrupt the other children, or you might start poking them or start, you know, doing all of that because they're uncomfortable and they can't sit and focus, because without core strength, we can't sit and focus on more intricate skills of, you know, concentration, cognitive function, speech and language.
We see that with the kids writing at the table. If we're getting them to do literacy, they'll put their head down on the table and they'll say, oh, this is too hard. And they're always slumping over their chair. And then that's through our collaboration. I was like, oh my gosh, it's the core muscles. We need to strengthen those.
Another one, like, are you having difficulty at mealtime? Are they not eating anything? Are they sitting on the right chair? You know, is it giving
positioning
them
is so important.
Support? And then, you know, is their core function adequate to be sitting and using fine motor skills? Because without core strength, we can't focus on those other skills.
And so it's so important that we take the time. That's why a very thorough assessment is warranted as a professional. That's why you need to be collaborating with other professionals to see what their results have been. And that's why it's just understanding that the behaviour is not the end result. We need to go a bit further with that and look a little bit deeper.
Unpack it, So what we do before initials is we will, as part of our initial, phone the parent before, and we'll talk about what they're experiencing, if there's any preferences, if they've had a sensory profile done, what other health professionals that they're speaking to, what reports and, you know, what information that they've got. We get what they can passed on to us, and we will, if we can, talk to the other allied health professional and find out what their experience is and what they've done, because most of the time they will have seen an OT before they come to us. So we can get that information and go into that session setup, and we can set up our session based on that information, and it gives the parent an opportunity to talk about what's going on without talking about it in front of the child, because that's something that we see.
That's a big point.
That's something that we see as being quite difficult when we used to just do the initial, and the parent's like, oh, I don't really want to talk about this in front of him. And I'm like,
I'm very conscious of that with my girls.
So I think that's really allowed us to get the full picture, and we're setting ourselves up for success so we can have a good intervention and set the child up for success.
Often with any of my school-age children, I will say, oh, do you want to take that book and read outside when we go through the results? Because that can be really damaging. They understand if they're if they're sort of hearing their limitations.
That's right.
But we do have to discuss that to have the baseline. And we're going to improve on all those things, but they don't hear that. So that's a really important point. Don't discuss those. Always check with your parents if you should be discussing things in front of their child or what they're comfortable with. And then, you know, going from there, being led by them a bit. Some parents are really open and some children are really open. That's fine. But you've got to be really careful that you address both the child and the parent in those situations. And you're not just speaking about the child to the parent like they're not there. Because that's not going to set them up well.
Right. And I think I've got a couple of clients in our Kids Heart Pilates clinic that have demand avoidance. And so we have to work with the parents in terms of setting up what's appropriate in that session, because quite often we'll say, you know, if you do this, you'll get to go here, or, you know, and so working with the parents to set up appropriate rewards. We'll use rewards instead of bribery, but in that situation where they've got pathological demand avoidance, it's really difficult to engage because they don't want to follow instructions. They want to be in control. And so we find things that they really like. We then work in with the parents in terms of setting them up for following what we're doing.
And that's really that principle of really trying to understand them first, understanding them, and then making yourself understood by what you're going to do. Often as health professionals, we're all guilty of this. We'll go in and we'll go, I need to be understood first. As a health professional, this is what speech pathology is. This is what we can do. This is how we can help your child. We just maybe need to think, we need to seek first to understand, then to be understood, which is a principle.
Steve Covey. 7 Habits.
Genius. A life-changing book of 7 Habits. But that principle is what you're applying here. And so it's also important, I think, just when you're in the moment with the behaviour, and if you don't know what to do, or it's a really confronting behaviour or a new behaviour, or it can be quite intense, the behaviour, it's really important to keep perspective of that child
Yeah.
and who they are.
Yes.
It comes back to values, but understanding that you see the potential of that child.
Yes.
Even that's your job, because the parents can sometimes really struggle with that.
Yes.
So your job is to pull out the greatness in that child and to see them for who they are once you then go through all the layers of behavior. Because like we said, behavior is just what's happening on the outside.
Yeah.
There's often a lot of emotions and things happening on the inside, and it's being able to just process those thoughts in the moment and going, okay, this is the child, what they're doing.
Yeah.
But this is not who they are.
Yeah.
We're not our feelings, you know, and say, if you can actually think that yourself, you will convey that to the parent to help calm the situation.
Yeah.
And then you actually then sort of can filter through the behavior to see what is actually happening here. Let's analyze the situation. Okay, like you said, do we need to change the room?
Yeah.
Do we need to change the activity? Are they overstimulated?
Do we need to change the time of day, like stuff like that?
And you know, in those moments, that helps you become a really good critical thinker, which is what you need to do. That's your job in the moment. It's not to get caught up in the emotion.
Yeah, because the parents will be triggered, I find, if the behavior is undesirable. And I'm speaking from experience of my own children as well. We get quite triggered by that. We're like, oh, we're not fitting the social norms here. Yeah. And really, if we're not thinking about it from that child and what they're going through.
Yes.
So it's really important as a parent and as a practitioner to understand that might be happening and reassuring the parent that it's okay.
We actually do that before they even come into their sessions. I think you do too. We make sure that we say it on the phone, and we make sure we write it down for parents, because as a parent myself, you always forget what people tell you.
Yes.
But we always say, like, your child is coming in here because your child needs to come in for a reason. They need help. So please don't be embarrassed, particularly in that first assessment session they come in. If your child runs around our waiting room screaming, we are not bothered by that. Our admin are not bothered. No one is judging you. We are here to help your child. And actually, the more that they are themselves and do that, the more we can see what's happening. So then we can go, okay, this is what we need to assess. This is what we need to look at. Let's have a look. So even doing that as a therapist before they even come in just hopefully like sets parents' minds at ease. I feel like I would feel more at ease as a parent.
100%.
If I was going in and going, okay, that parent over there knows what I'm going through. Like, I'm not being judged here if my child is running around. I feel like I'm not being judged because I don't have a lack of control. I'm really trying, but I can't get my child under control. That's why I'm here. And if you can't feel safe going to the place where you need help, then that is often a barrier for parents accessing help.
Yeah.
So it's putting that out there.
Remove as many barriers as you can.
Yeah, no one's judging you. Even kids are kids, right? Even when kids get with other kids, it can hype them up.
Well, kids feed off energy, don't they? So if that parent's being triggered as well, if you can help to bring that response down by putting practices in place prior, then they're going to be calm, you're going to be calm, and the children are going to feed off that.
Yeah. It's your job. I mean, as a parent, in parenting, I have learned it's your job to be the calm in the storm. The same thing applies as a clinician, but even when you're dealing with parents, it's your job to be that calm in that center. That's why they're coming to you as the professional to give them some sort of hope, security, going, this is okay.
Yep.
So in terms of clinicals or having a clinical plan or clinical strategies to manage behaviour, so sort of talked about setting expectations with caregivers, trying to develop that trust first. If that means actually having a phone conversation or, talking to them without the child beforehand, doing that, or
providing resources
in the session, doing that, when you meet them, having those sort of conversations with them. It's also, I think, not being afraid of challenging conversations with caregivers or parents and to help them get on the same page. It's like we're not avoiding having the hard conversation that your child is running around, hitting their head on the wall or bashing the door down. We're not going to avoid talking about that. We're going to confront it, have that challenging conversation. Even if as a new grad you don't know what to offer, it's good to still acknowledge the conversation and say, okay, I want to just understand the behaviour so I can get a good plan going forward. You don't need to provide strategies straight away.
Yeah.
And it is difficult, like even in this podcast, it's difficult to say a strategy because every child is different and often it's really working it out
every
in the moment.
situation, right? And I remember you saying in one of our catch-ups with my mentor membership, that you will ask parents if there's, is this typical behaviour? And two, how's the day been? Have we had, any disruptive situations today? So just understanding like the kind of more maybe chronic or long-term behaviours, and then understanding the more acute, like what's been happening today, and getting an understanding of that
100%.
in time.
Like even as a mum now, I always like to get to activities 5 minutes beforehand, like say swimming.
Yeah.
Because if we rush in and I just have to chuck Evie straight in the swimming pool, she's just like not sure of what's happening. And like this is swimming that we do every week. It is good to just go and for them to go, all right, I'm in the swimming pool. I'm in the swimming centre. I'm watching all the other kids. Okay, go in with ease. That often always can't happen. Like if you're picking up siblings from school, and that's often with our speech therapy sessions, the child's come in and the mother's like, we've just dropped this off. I've had to wake up a crying baby, or I've had a crying baby in the car the entire time coming here.
Yeah.
Or they've just not woken up well. I've had to wake them up to come here, often with the littlies if they're coming in the afternoon. They've just come up from their sleep. And so if you're not asking those questions, what has happened today, you then come in and think it's you.
Yeah.
You think, what's happening with this child?
Yeah. I can't manage this child. I can't engage them.
Well, you might be like, this is really out of character. I'm a bit thrown now. But if you have the knowledge, you understand. Knowledge is power, right?
Yeah.
You understand what's happening. But
be curious,
also
always.
be curious and saying, like you said, is this typical behaviour? Like in your first assessment sessions, I once had a child come in and they were literally trying to climb up my walls. Like, you hear the saying climbing up the walls.
Yeah.
It was actually happening. I had an autistic child.
Yeah.
And they thought they were Spider-Man and they were trying to climb up the walls.
Right.
And he was literally, I had a door that had like little panels on it. He was literally trying to put his feet and climb up the door.
Wow.
And if I didn't seek to understand in that situation, I would have been prescribing the whole different treatment. I could have been giving lots of different referrals. But even when I asked the mother, is this typical behaviour? She said yes, because he thinks he's Spider-Man. He's going through a Spider-Man phase. Yeah. And I was like, right, well, we can incorporate that in the session. That's not a bad thing. I was just about to say, that's
awesome. Let's do this.
That's fine. That's nothing I can't work with. That's not really a disorder or a delay. Maybe then looking at, again, why he's doing that. Yeah. Then the underlying issue was he wasn't understanding what was happening in his environments. He had a receptive and expressive language delay. Yeah. So he wasn't understanding. So he was like, well, I'm just going to go into my imagination. Yeah. I'm going to create my own world, which is a Spider-Man world.
Coping mechanism.
Yeah. So, that then helped me to be able to try and build that understanding. Right? Yeah. And work with the family so that they didn't feel anxious, because the mother was so used to pulling him off walls and pulling him off doors. I said, you don't need to do that here. I will go over to him and we'll start to do some receptive language therapy using the wall and climbing. And now that I know you, Lizzie, and your movement, I was like, that's a great combination. The movement with the language therapy, meeting him where he's at, being child-led, and we got really great results with him over time.
And finding opportunities, right? So being led by the child and then finding opportunities. So, and then being able to educate the parents. And I think this is a skill that comes with time. So when you can you confidently understand how a child develops and how therapies are going to benefit them, and for us as exercise physiologists, how we prescribe an exercise and the scripting that we use for an exercise, once we're really confident with that, then we can almost multitask and go, okay, we're going to get you to do this. Let's lie down and pretend we're flying like Superman and shoot our webs out. And then while they're doing that, you can say to mum, this is really good for our posterior chain strength, and, like a whole bunch of things. I have a little autistic boy that comes in, and he loves sword fighting. So we do sword fighting, and I talk to Dad, because Dad's like, oh, gentle. And I'm like, no, this is actually really good. He's got both hands on the sword. We're crossing the midline, bilateral integration. If you can do this at home, this is going to be really good for him. We want to encourage him stepping forward on both each feet, and so it's just being able to layer that education into the parents so that they can see that, this is aligning with the interests of the child, and we can actually be led by the child, find opportunities to get therapy in there without, causing too much stress for everyone.
Yeah, or trying to force them into a mold to do something that they're not interested in.
It won't happen.
No, and that was also a reflection of risky play. That sort of reminds me of that.
Yeah.
Even me, I'm guilty of this, but it's like be gentle, trying to fit them in. But often they're actually just exploring and learning, and that risky play is really important, a really important part of development.
Yep. And particularly for children with autism.
Yeah. Yeah.
Because that's, like that's a skill that they need to work on.
There's lots of research around that.
Yeah.
And so I guess, another thing you did allude to before was modifying the environment, like, dimming the lights or putting a smelly thing on.
Put lavender. We put lavender on. We turn the lights
essential
off.
Oils.
We put relaxing music on, and I make sure, because I'm quite expressive and can be quite loud, but that's not the answer to all children. And, if you've got a hyposensitive child, that might be great. Loud music, loud voice, or, dominant voice. But with children that are hypersensitive, we need to adjust what we're doing.
Yeah. And that's a really good point in there. I always talk to my mentees about that in the Preschool Language Accelerator. Often we think when we're trying to add intonation, we add volume.
Yes.
They are two separate things.
Yes.
So you can actually have a very varied intonation without adding volume. But don't get confused on that, because I've seen so many clinicians and new grads that think they're doing intonation, but all they're doing is adding volume.
Yeah, interesting.
So we've got to, even breaking that apart and going, I can still have intonation, but I didn't just yell at you.
Yeah.
And knowing that's how you can modify.
Yeah.
And even in that, what you're doing is you're managing the parents and the mental health for all parties.
Yes. Yeah, because I think you really, like, when you're working with kids, you're not just working with kids, you're working with the whole family. And we need to be mindful and seek to understand all parties in each child.
It's not
like
just
all
the child.
involved people. Yeah.
And the parents have such a powerful impact on the behaviour.
Yes.
As well.
Yeah.
And then obviously children need trust.
Yes.
As well. We need to create a high emotional bank account with them. So it's
and parents.
So, in our speech therapy sessions, we always try to have lots of games, and if a child comes in, we might just do bubbles first. And when we're talking about building trust, it doesn't need to be this long drawn out thing. No. Children are very easy to give their trust and they're very quick to give their trust. Yeah. That's what's so beautiful about them, their innocent natures.
Yeah.
And so it's, instead of just going in with your agenda, it's like, okay, we might do bubbles first. We might actually play a game first, which has no clinical goal in it. You take away the demands, because that's building the trust, then to then put the demands on them. So they
do you know how good bubbles are for children?
Oh, and clinicians, no prep. Yeah. It's like no clean up. You can just do it so spur of the moment. It's amazing.
But it's so good. I use bubbles all the time, because kids see bubbles and they move.
So true. Yes. Even if they can't move, they try.
Yeah.
They're putting their hands pointing.
Yeah, I go out in the backyard and I put the bubble machine on, and the kids are just running around. The dogs are running around, chasing the bubbles.
Those bubble machines are psycho.
Yeah, I know. I know. They're like too many bubbles. But
maybe not inside for a bubble machine, unless it's a very little one.
Yeah. But like, how amazing. And so you can insert therapy and interventions into games.
Yeah.
Without anyone knowing.
But the thing is, then you do want the parents to know. Because then parents come in and their biggest complaint if they've transferred from another service was that speech therapist or EP was just playing with them. They didn't have any goals.
And that's where you need to master that skill of being able to insert the therapy and then add in a slice of education.
Yes.
So that they really understand what you're doing. And I find that with parents and also with educators in early childhood settings, because they don't understand. And that's why they're seeing us, because they don't understand.
And the research does say that. There's a model or a framework in how you sort of can communicate best with caregivers.
Cool.
And there's that framework saying, the best way to do it is in the moment as it's happening. So you're doing the therapy with the child as they're blowing or popping the bubble. Then you're looking at the caregiver or the parent or the educator, talking to them in the moment. You then show them again, you demonstrate what you've just done. And then you come back to them for feedback and you ask them, did you see that? And then the next step is saying, okay, your turn. getting them involved. And there's actually research that
Right.
says that framework of that cyclic model is really what we need to be doing.
Amazing.
But
Yeah.
also that's really great from a practical point of view. You're not waiting to the end of the session and saying, now I need to have a 30-minute discussion with you.
Yes.
You actually get to the end of your session and you're like, great, so you understand what you need to do
Yeah.
this week? Yep,
Yeah.
great, see you later. And you stay on time.
Yeah, and you're managing expectations throughout the whole session. So it's not,
Yes.
they're
They don't
not
just think you're
building, they're
playing.
not sitting in there building up this resentment towards
Because they
what you're doing.
don't understand. It's that same principle with the parents, getting
Yeah.
them to understand. And the amount of times I hear a parent saying they just played with them.
I know. All the time.
But I'm like, children learn best through play.
Yes, absolutely.
Children, even adults, we don't want to sit down at a desk for hours and hours and
No.
hours. We need to get up and move our
Yeah.
bodies. We need to be engaged. We need to have things that interest us.
Yeah.
So it's interesting how we as parents can apply different
interesting,
standards.
isn't it?
It's just what I think we should be
Because
doing.
doesn't everyone know how powerful play is? Like, it's everywhere.
You would think that, but that's what we're dealing with. A lot of parents have never had experience with children before. They might
But
have
do you
no
know,
exposure with work.
like we were saying, seek to understand, parents are there and generally they're anxious. So they want to see results. I had a client coming in and his parent was bringing him in and she was getting in the session and, getting him to do things. And then I had the support worker bring him in and we would get more in with a support worker because there's just less pressure because she was just anxious. She wanted the results, but we need to build the connection first. We need to make them feel safe first and foremost so that they keep coming back.
Yeah, it's the
We've made
underlying
yes.
the results are the end goal, which is a very important goal.
But
You can't go there
long-term
straight
plan.
away.
Yeah.
You break a child's trust if you do that.
Yeah.
Another thing that I think can be helpful is to make considerations on the other side of your timetable and environment. If you've got children that have really challenging behaviour,
Yeah.
you then might have a space after that session.
Yes.
Or you might then say, because sometimes you can have older children or boys and they might be swearing a lot in the waiting room. And then I come in, say with Evie, who's 4, and I'm like, oh my gosh.
Yeah.
But so then a good thing to manage as a therapist is then speaking to the parents on either side of your therapy sessions and saying, so this child is going to come out. They may be swearing. If you want to keep and wait with your child outside, do that. So it's looking at the behaviour and modifications around in the timetable.
Yep, absolutely. I think that's really important. And again, it's just adjusting expectations, isn't it? It's setting everyone up for success so that there's no surprises. And if we can schedule around that so that it's appropriate and everyone's getting, the most out of their sessions and they're understanding the situation, then everyone's going to have a better experience.
And your admin can help you with that. That's what admin can really assist with. They can actually say, hey, are you okay being in the waiting room? This child's going to come out. He, has his own difficulties. We're working with them, but he might come out swearing or he might come
yelling
out hitting the wall,
or, being
if
loud.
that's going to distress your child,
Yeah.
because then that child needs to be coming into therapy. You don't want that child then put offside.
And they have their complex needs as well.
Yes.
So everyone's feeding off everyone.
So that's where admin can be really powerful, empowering them in your team, in your room and your sessions so that they have that ability to facilitate that for you. If you've got clients back to back or you're feeling a bit busier under the pump, they can really facilitate that. And then likewise give you feedback if you need to change something.
Yeah.
If they were like, the waiting room didn't work, this child was settled, then they got unsettled before your session, I think maybe they should wait outside.
Yeah.
Or take them outside for their session.
Yeah, that's right.
You can
Absolutely.
sort of look at that.
So I think being flexible and working on your mindset and your own expectations is really important around what we can achieve, what is, what's practical and like leaning into the unexpected and the opportunities.
Being okay with the unexpected.
Yeah.
It's realizing the unexpected is not bad.
Yeah.
It's not threatening.
Yep.
It's unexpected. It's unknown, but that doesn't mean it's bad. It can be better.
Yep. And just keep working on your mindset and your tools and your strategies so that you can pull on anything and not freak out in that moment.
Yeah.
Because that's not going to
No, you can't freak out. But, you can also, like the beauty of being in a clinic is that you can also go and grab another speechy in the moment or like EP in the moment.
Or admin, like support.
And bring them in to help you. Yes, there's actually a couple of times where I have asked my admin to come in, because they have, well, for whatever reason, calmed my child, you know, because it can change. You can calm your child one session and the next session the admin can calm the child. And so I actually have really utilized my admin that way sometimes, where I've said, can you hold their hand and bring them in? Because you've been that calming presence for them today. Can you come in and help me play a game? Can you actually, sometimes there have been some instances where I've had really big teenage boys. The parents have actually had to step out.
Yeah, I was just about to say that.
I needed help. I wouldn't say like restraining the child, but I did need help. Like sometimes if you've got a runner, I had a child that would just run out the door. So I was like, I need you to grab the other hand of him so that for his own safety, he's not running out the door. We're not dragging him back, but we need to have him. And there are kids where the parents say their hand always needs to be held. They're a runner.
Right.
And they will run.
Yeah, that's
so
right.
Things like that. It's grabbing other people in your team and saying to them, I have a tricky session. Be aware, be available.
And what a great opportunity to all learn from one experience, like so that we're all sharing your basically case conferencing. You know, and we're all learning from the experience. The other thing I was going to say is sometimes kids will behave a certain way when their parents are there versus when their parents
don't we all
there.
know it? Don't we all know it as parents?
So that's another consideration, you know, is it worth asking the parents to sit outside, or if they've got siblings, you know, what part are they playing in the behaviour and what is going to set everyone up for success, and having that conversation whether you feel like it's difficult or not, you know, just addressing that, because again, we just come back to the child and what does the child need in that moment and what does the parent need in that moment, and kind of communicating with those in mind.
It's a journey. Like if the parent has to sit out for one session, it doesn't mean that's the way it's always going to be.
Yeah.
Obviously, you would hope that one of your goals is working towards having the parent in the session.
Yeah, and it might just be that particular session. Like I've had sessions where Flynn is in speech and I've got my other son Marley there, and Marley's being really disruptive and distracting Flynn, or he's playing with toys and Flynn wants to play with toys. So I'm like, okay, we're just going to sit outside, and they get heaps done.
Yes.
So it's just being able to, as a practitioner or clinician, read the room in what needs to happen in that moment and being able to communicate that.
Yeah. And that's that trust.
Yeah.
It comes back to that trust. Yeah. In terms of actually in the moment with the behaviour.
Yeah.
I mean, it depends on what level your child is at with their behaviour. I always like to have a mode where I will make sure I'm putting more praises in.
Yes,
to
absolutely.
corrections.
Yeah.
Because if you're really confronted with negative behaviour, even as a parent, I can find myself saying, stop, no, stop,
me too.
no, blah, 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 blah. And so really children need that positive praise, positive affirmation of what the right behaviour is.
Yes.
So it's important that if we are correcting our child, we go the extra step. So we don't just say to them, no, that's not appropriate, or no, we don't speak like that here.
Yeah. Or you're naughty.
Because you're not actually, you're just correcting them.
Yeah.
Well, I would never say you're naughty.
Yeah.
Where we'd always, because that's then affirming, that's actually not, that's actually taking,
if
you're saying you're naughty, you're defining them.
Exactly.
You're
You're labeling them.
Yes.
And that's
who they are at their core, but it's not.
That's something that's been recently happening with my youngest. And I found myself saying, oh, yeah, he's really naughty. And I'm like, oh, my gosh, I can't say that, because that is then becoming his identity.
Yes.
But it's not him. It's
so you're better off to
behavior.
Label the behavior.
Yeah.
Because you've then made a judgment that that behavior was naughty when actually he could think totally different.
Yeah.
It may not have been appropriate, right? That's okay. But it's what we're labeling behavior as.
Yeah.
And so
and focusing on, like I've now kind of redirected and spoken to everyone that is with him, that he's really good at doing things. And I'm like, you're always so helpful. Come on, Marley, you're so helpful. Come and cook dinner with me, because he likes to be busy, he likes to do things. So I'm trying to focus on that rather than, and interrupt those moments of non-ideal behaviour and going, hey, come on, Marley, you were so helpful this morning. Let's go and do this again. And that really is effective.
Yeah, so it's redirecting them.
Yeah.
It's then showing him an alternative.
Yes.
So you're not just saying, no, stop doing that, because they're not actually learning. You need the next step of saying, okay, so we don't, say for example, a child says, I don't like you.
Yes.
I hate you.
Yeah.
Which can be happen to a therapist or a parent.
Yeah.
So we would say, okay, like you're kind of correcting what's appropriate.
Yeah.
We don't speak like that here, but you know, you could say another way to say something or to express your feelings is talking about, have I upset you? It's not a counselling session, you know, but how I upset you. I like to say to people, I love you.
Yeah.
I like being with you.
Yeah.
And then I would then make sure that I would say that 5 times in the next activity. Oh, I really like being here. I really like playing with you. I really like sitting with you. I really like being next to you. I really like how we can cross our legs together. Whatever it is, you just pull anything out.
Yeah.
I then reinforce that to model that to the child.
Yeah.
And then it doesn't automatically mean they're going to change.
No.
But you're in control of what you're doing in that moment. And then you're saying to them, so let's, like, if obviously in a therapy session, that's probably as far as you'd go. You're modeling that.
Yeah.
But then if you're with your own child at home, you'd be saying, okay, let's, like, why were you saying that? Obviously, again, it depends on what level they're at and their language abilities. But Evie's really good at saying to me, oh, well, you took my toy. And I was like, I didn't even realize I took your toy.
Yeah.
I was cleaning up.
Yeah.
And so I say to her, oh, I'm so sorry that I took your toy.
Yeah.
You just let me know.
Yeah.
Rather than saying I don't like you.
Yeah.
And so we've actually then just really dissected the behavior of what that is. And that's the same in our sessions. Obviously, again, we're saying no, that might work for one child, might not work for another child. It's based on all the things that we've spoken about, but it's looking at how do we actually have that correction and reprimand, just a little bit of a structure.
I like
add the praises in. Make sure you've got praises, and that is a little bit of a structure ratio. Yeah. Like if you need a bit of structure, you can make sure that you have 5 praises. Yeah. And then you might correct a behaviour. It doesn't have to be, again, it's changing, but just if you need a little bit of structure, make sure your praises outweigh your corrections.
Yeah. And what we find is we have kids coming in and they're very rough with the space, like you mentioned before, but because we use balls a lot, so they're throwing the balls at the artwork, and we're like, oh no, we don't throw the balls at, you know, we're not, we're keeping our space safe. And then I'm like, but you are so good at throwing. You are so redirect good where at throwing.
Yes.
Can you throw that to me? I'm going to see if I can catch it. I don't know whether I'll be able to catch it because you're so strong. But I'm like, and anytime they're doing anything that I see as, you know, good from a motor perspective, I'm like, oh my gosh, you're so good at that. I mean, it's not even when it's just that I'm inserting that in like fairly consistently throughout the session and focusing on that, not even, you know, in some respects, not even addressing the poor behaviour. Like focus
and
on
I mean,
the good.
That is something that we have to be careful of as clinicians is the word no.
Yeah.
Because it can be super triggering for children.
Yeah.
As a clinician, I don't think I really say no. I would always expand on it.
Yeah.
Because first of all, if they've got a parent all day saying no, you're going to get them offside even more in your sessions with their behaviour. But then I would always, like, saying no doesn't really serve a purpose.
No, that's
unless they're doing something that threatens the safety of the child. Yeah. But generally they actually have a language delay associated with that. So they're not understanding no anyway. So
so actually so interesting though, isn't it?
Yeah. So I would always then be saying, like, this is something that comes with experience and being in the moment and having that. I think you say no and then you realize, wait, I shouldn't have said that. Yeah. You then recorrect yourself. And it's with that experience, I wasn't always able to sort of quickly shift or change a situation.
Yeah, it's kind of that almost being able to improvise and
so if a child is throwing a ball at the wall, I don't say no. Yeah. I would say, oh, we don't throw the ball at the wall, throw it to me.
Yeah. Yeah.
And I would always articulate what the behaviour is. I would provide the correction, then provide the remodel. Yeah. And I learned that as a new grad early on. Yeah. That word no doesn't work. So don't say it. Yeah. Don't say it. And half of my children had language delay, so they didn't understand the word anyway. And I would then couple it with the action with showing, remodeling what we need to do.
And this is why this conversation is so powerful. Because exercise physiologists aren't looking at it from a language perspective, but we're seeing people with language delay. Yeah. So understanding that is just so powerful in what we're doing and success in our intervention.
Redundant word, like, no.
Yeah.
Yeah. Or triggering, which can make behaviour worse. They can spiral. So some things to be conscious of when you've got behaviour. Again, we're not going to say do this, do this, do this, do this. Yeah. But in making all these considerations, thinking about them, taking these suggestions to your team or taking these mindsets and frameworks to your clients, it will make you a better clinician, help you feel unafraid or not as scared of behavior. You are going to have moments where you're just like, I don't know what to do, because every child is unique and different. That's okay. But then having tools in your toolbox to try and sort out, okay, how do we understand and get through this? How do we take responsibility? How do we understand, seek to be understood? What can we practically do with our parents? How can we set up our sessions, our environment?
What's the underlying issue?
Yes, looking at all of that.
Yeah.
And then even talking to other professionals. Talk to a psychologist.
Yeah.
Talk to an EP. Talk to a species like we've done today.
Yeah.
And then that is going to give you a really well-rounded approach of what to do or how to approach the situation if your child is misbehaving or it's impacting on you being able to get progress and therapy goals. And it is okay. Sometimes you might need to have a bit of a different journey where they might need to pause therapy to go and sort that out and come back. That's okay. That's all right. But you have all these different options for you. And so hopefully through what we've discussed today, you can feel powerful because you have knowledge in how to deal with behavior and you feel confident with that.
Yeah.
And if you want to explore more discussions with us, hit us up and we'd love to sort of help you and guide you if we can.